Okay, so welcome everyone to the second module of the comprehensive Yemeni Neurosurgical educational course. In this module, we will focus mainly on the supratentorial anatomy of the cerebrum, and we will start today with two distinguished speakers. First, we have Dr. Koray Ozduman, Professor and Chair at the Department of Neurosurgery at Ekbidam University School of Medicine at Istanbul, Turkey. And he is also the founding member of the Brain Tumor Research Group at this university and performing basic and traditional science work. Dr. Koray today will talk about the general anatomy of the CNS. Doctor, please, you can start. And I hope I pronounce correctly.
Thank you very much for this kind introduction. My name is Koray Ozduman. I come from Istanbul, Turkey, and I work at Acıbadem University. And I basically focus on brain tumors. Today, I am honored and privileged to share with you this talk as a part of the World Federation educational courses. Today, I'm going to talk to you about the general anatomy of the central nervous system. I'm going to start with actually two questions for you. The first of these questions is, does any one of you know why we call the frontal lobe, and the temporal lobe, and not something else? During the talk, you will learn about these small details, which will make the life a little more easier for you, and to understand why we are learning anatomy. What's the need for us to learn neuroanatomy in greatest detail, and to advance it every day even further. So, as you know, the central nervous system, during its development, is made of four different parts during the development. The first of these is the prosencephalon. And this prosencephalon part makes up the brain cortex and also the diencephalon. And as you know, the diencephalon will turn into the thalamus, hypothalamus, the pituitary, the posterior pituitary gland, the optic nerves, and will be developed into these portions of the brain. The mesencephalon will develop into the midbrain, as we know. The rhombencephalon will develop into the pons and the medulla, as we know it. But in general, these general terms usually do not tell you much about the function of the central nervous system. Therefore, I think it's a better idea to divide it into three portions. These are functional computational portions. The first, and probably the most important, what makes us human, is the cerebral cortex. The second, the very important part, which is lying underneath the cortex, is the white matter connections of the brain. And then at the very center, we have the central core. The central core is an automatic machine. It does not computate long functions or complex functions. It does not have behavior. It does not have language. It does not have the detailed functions that we attribute to a human. It primarily focuses on reflexes that keeps our body within the right homeostasis. So the sodium should be within normal limits. The blood pressure should be within normal limits. The blood circulation should go on, and the patient should be awake. And all these functions are automatically done by the central core. But the cortex is, again, like I told you, what makes us human. Therefore, this computational unit was in the focus of humans for a very, very, very long time. Now we should make a differentiation between two parts of the cortex. Today, we differentiate between allocortex and isocortex. In the old days, we used to call these paleo and archicortex, which made up the limbic part, and the neocortex. But it's a better nomenclature to call the neocortical part the isocortex, and the paleo and archicortical portions of the limbic system as allocortex. But then, again, you should basically divide the cortex into these two parts, the allocortex and the isocortex. First, we should start with the allocortex because it's better, easier to comprehend, easier to understand. Neuroscientists like surgeons and anatomists early on realized the importance of this limbic system as we know today. But the first person who named this portion of the brain was Thomas Willis. Willis told us that there's a portion of the cortex that lies around like a belt around the brainstem and the thalamus. So the central core of the brain. So the cortex that lies around the central core like a belt, he called the limbic lobe. Limbus means the lip or the surroundings, the belt that is surrounding the central core of the brain. Over the years, people started understanding more about the functions of this portion. The first of the researchers who started working on this portion was Paul Broca. Broca, as we know from the Broca's aphasia. Broca, in 1838, told us that the limbic cortex is mainly concerned about olfaction, about the smell. Then, in 1905, another German scientist, Christoph Jacob, realized that different portions of this limbic cortex, what they called the great limbic lobe by Broca, was very much interconnected between different portions. And these portions were, again, interconnected with the isocortical portions and also the brainstem. So he thought to himself, this must be playing an important role in the homeostasis of the body. Then you probably all know the name of James Pepys. James Pepys in 1937 described the Pepys circuit that is required to produce memories, to write new memories into our brain. Early afterwards, another Russian-born American scientist, Paul Yakovlev, I'm sorry about the misspelling of the name here. The name is Paul Yakovlev, described in 1948 that the limbic lobe is also concerned about emotion. Early after him, Paul MacLean integrated all of these informations. This means this lobe is connected with smell. It induces our body to work harder to collect information about the location of food and to remember it. First to smell it, understand where it's located, and then to remember where you find your food yesterday. So Paul MacLean said all of these singular functions were all interconnected within the limbic system. After him came Marcel Mesulam. Marcel Mesulam is a very important neurologist who worked very much on language problems in human, defined these two areas, two belts of the limbic system. the first part of these belts he called the olfactocentric portion. The olfactocentric portion was the portion that Paul Yakovlev had described. And this portion is concerned about getting the smell and getting emotions about it, like getting hungry and maybe feeling the beautiful smell of the cookies that your grandmother has done for you from your childhood. So these memories should have an emotion related to them. He also described a second part, the hippocampus-centric portion of the limbic system. This second part, although it is connected to the olfactocentric part, was working on its own to develop new memories. And based on these, Marcel Mesulam also looked at the histology of these portions. He quickly realized that there were some phylogenetically older portions of the limbic system, and there were also some newer portions of the limbic system. He quickly realized that the newer portions of the limbic system were more associative centers. Associative meaning when an information comes to you from the piriform cortex about the smell, and then another information comes to you about your memories from your hippocampus. Then another information comes to you about your drive to have offspring and your drive to eat and drink water to continue your hemostasis. Somebody needs to gather all these information and associate them and come with a conclusion about it. So the newer portions, the more complex and phylogenetically newer portions, were actually the insula and the cingulate gyrus. And these portions were the most complicated portions of the limbic system. But very interesting, these portions resembled the isocortex, the old neocortex that we knew. But older portions of the limbic system were actually not as well developed. Let's look at the picture here from the substantia innominata, the cortical portions of the brain that are located just above the middle cerebral artery, where the anterior perforated substance is located, and this area we call the substantia innominata. And in this portion, you see that the neuronal bodies are haphazard. They're not organized. They're just lying around, just like in the nucleus of the brainstem or in the nuclei of the thalamus. So these look like nuclei rather than the cortical layers of the isocortex or the neocortex that we know. But the more complex functions these limbic portions were doing, the more complex the anatomy became. When you looked into the hippocampus already had 4 layers. The CA1, CA2, cornea monis 1, cornea monis 2, cornea monis 3, and the dentate gyrus. So 4 layers to it, as you're seeing on the upper right picture. But when you go to the insula or the cingulate cortex, you're seeing that these are those very closely resemble the isocortex that is located on the superficial portions of the isocortex. So these already had 6 layers. And when we look at the isocortex, towards the occipital pole where the vision function is located, you start seeing 8 layers of layerization. So the more complex functions you're doing, the more complex and the more orderly the anatomy becomes. So within the limbic system, Marcel Mesulam defined that these functions should go from very primitive to very complex. And he said to himself, the limbic areas are just next to the brainstem. As the name denotes, like these are the limbus, the belt around the brainstem. the belt around the brainstem gets the information about the internal milieu. Like this means your sodium content, so the water content in the body, your need to feed yourself, the need to produce offspring. So these very basic functions were already coming from the central core of the brain. But the limbic system with the olfactory cortex, the piriform cortex, was getting the smell information. With the hippocampus, it was getting the memory in addition to it. The amygdala was giving the orders to go and feed yourself, to go and eat. So these informations were driven to the paralimbic areas that you're seeing here. And the paralimbic areas I'm telling you are basically the insula and the cingulate gyrus, the more complex, the more associative parts of the brain. So this means you get simple information and feed it into higher order, more complicated, more associative information. The same should also exist for the isocortex, Marcel Mesulam said. Okay, he said this, but what did we know? In the early days, we realized that the isocortex or the neocortex should have a similar organization, but we did not know much. In 1838, this anatomist that you're seeing on the picture here, Friedrich Arnold, said that we should call the lobes of the brain, these anatomically and functionally cohesive areas of the isocortex, based on the bone that's overlying them. So we call the frontal lobe because it lies under the frontal bone, thanks to Arnold. And then you call the parietal lobe the parietal lobe because it lies underneath the parietal surface bone. So based on the suggestions of Friedrich Arnold, we started calling these neocortical areas based on the bone that overlies them. But this did not give us much information about the function. One of the first names, again, to work on the function of the isocortex was, again, Paul Broca. In one of his patients, he saw the patient became abruptly unable to speak, unable to express himself, and unable to speak out. He followed this patient for some time, and the patient died, and he did the autopsy and reported the results of this autopsy to the French Academy of Sciences. In the French Academy of Sciences, there were two things that he was saying. First of all, and most importantly, he said, speech is lateralized. Speech is located on the left side of the brain. Speech is localized on the left side of the brain. The second, less important, but more important for us here, information was saying that the inferior portion of the frontal lobes is concerned about the speech. So now we had an idea that the frontal lobe might be doing some speech function. Sometime after him came Carl Wernicke. Carl Wernicke told us that the posterior temporal lobe, superior temporal gyrus, posterior portions of the superior temporal gyrus, were taking a very important role in understanding. They were taking a part in language, but understanding part of the language. So now we had an idea that the temporal lobe might be doing a function about speech. And then people started working very, very hard to understand the function of different portions of the isocortex, of the neocortex. First of all, by looking at its neuronal anatomy. We call this cytoarchitectonics. Cytoarchitectonics means the architecture of the neurons located in this area. The first one is very, very famous. Everybody knows the name of Corbinian Brodmann. From Brodmann, we learned that the brain is not a homogeneous, does not have an homogeneous isocortex. Different portions of the cortex do have a different anatomy. And then this was again supported by the work von Economo several years after him. Economo went into more detail, did a more elaborate map of the brain neocortex. These two researchers, both Brodmann and von Economo, were actually the pupils of Cecil and Oskar Vogt. The Vogt family was a German family and is a very, very influential family in understanding the brain anatomy. Here you see Brodmann with them. Von Economo is here not with them, but in their small laboratory outside Berlin, they started looking at this cytoarchitecture first, but then they thought to themselves, oh, the connections of these neurons might be also of importance. Therefore, we should also look into how the myelin is located in different portions of the brain. So they also did a myeloarchitectonic map of the brain. So with these two maps, we started knowing more about the anatomy of the brain on the surface. Then came a neurosurgeon. In the 1930s, this Canadian neurosurgeon, Wilder Penfield, published in the very, very famous Brain Journal. This is a neurology journal, an English neurology journal. His works on the electrical stimulation of the brain cortex. And he quickly realized that the portion that is concerned about the motor functions had this homunculus configuration. Homunculus configuration means a somatotopic map of the functions that you're seeing here. So he described that the parasagittal portion was concerned about the movement of the feet and legs. The central portion was concerned about the function of the fingers and the hands and the arms. And the lowest portion was concerned about the functions of the mouth. Penfield got the Nobel Prize with this discovery. And he told us that this is a very, very important function of the motor cortex. But his work was not imperfect. People quickly realized that this homunculus was incomplete. The homunculus was a mosaic, had a mosaic distribution. In cats, you're seeing the example here, that the hip is located here, hip is located here, hip might be located here, hip might be located here. So it is not a continuous map of an homunculus. It has small portions that are doing functions that are related to each other. So this is called a mosaicism of the neocortex. And then an American researcher named Mountcastle told us why this is so. So this is probably one of the most important portions of the talk today. Mountcastle told us that the basic computational unit in the brain, is not the neuron, but a collection of neurons organized in the form of a cylinder. So he called these cortical columns. And in 1957, he described that each of these cortical columns does a very, very specific functions. We have thousands of these cortical columns doing thousands of different computational things, but in a very, very minuscule portion of the cortex. So this tells us why we do have mosaicism. The cortex is not like a football field that goes from one part of to the other. It is made up of cylindrical computers that are sitting on the surface of the brain, and each one doing a different function. But then because each of these computers need to be connected to each other, we had to learn more about their connections. And these connections came with the help of anatomists and neurosurgeons alike. The first one was Joseph Klingler in the 1950s, and Klingler invented the fiber dissection technique. The fiber dissection technique you are seeing on the left side. We are we know this very, very well today because we see it every day in our surgical publications. This came with the help of these three people. Joseph Klingler came out with the fiber dissection technique. Professor Yashar Gil, who was one of the pioneers of neurosurgery, who brought the microscope to the operating room, quickly realized that this was very, very, very important, and himself started working on the subject. And his pupil, Professor Ture, popularized this once again as a neurosurgical technique for understanding of microanatomy. So today, with the help of this fiber dissecting technique, we know that the connections, the white matter connections of the brain in much, much more details. From Maynard before in the 19th century, we had known that there were three types of them. Projection fibers that are connecting the cortical parts to the parts below. We knew that there were commissuration fibers connecting the two hemispheres, to the left, to the right. And then there were the association fibers, which were connecting each lobe within each other. But today, we know that they are functionally very important highways of connections inside the brain, and these can be divided into like almost 20 different connection pathways on both sides of the brain. It didn't stop there. We wanted to, we learned that these connections could bring two portions of the brain together. Then we went back to the map that Marcel Mesulam told us. So you have, in the limbic area, we spoke about primary functions like what the amygdala does, what the hippocampus does, what the piriform cortex does. But then there were association areas, paralimbic areas like the insula and the cingulate gyrus that were bringing those informations together and associating them. Like this, Mesulam told us that there were primary isocortical areas, primary sensory and motor areas, like the primary sensory area, or the primary visual area, or the primary hearing area, the Heschel gyrus here that you're seeing here. Each of these portions is getting one single information into the brain. It gets sensory information, it gets hearing information, it gets visual information, but it gets one single type of information. Then in the neocortex, we have modality specific. This means unimodal, one single mode, association areas. So the cortex around the primary visual area, the visual association areas, do one function. They look at the shape of what we are seeing, or the color of what we are seeing, or the motion of what we are seeing. So these are encoded into information. And then a higher order heteromodal association areas bring those together. The yellow roundish thing that you're seeing is the Volkswagen of your grandfather. And higher association areas bring those together again with the limbic system here that you're seeing here. And when you bring them together, you're seeing something yellow that moves from one part of the street to the other part of the street that is half a sphere. Then you say that this is a yellow Volkswagen. And then you understand that this Volkswagen used to be the Volkswagen of your grandfather. And you remember good memories about your grandfather, how you traveled to different places, sitting in that car together with your grandfather, going into the memory parts. So this means that different parts of the brain come together to associate the information that they have gathered in the beginning. So these are higher order heteromodal association areas. It didn't stop there. In the early 2000s, it was very well established. It started in 1980s, but then it was very well established in the 2000s that the vision information was not going into one place only. There were two streams, two streets that were carrying that information. One part was carrying the information to a what cycle. So you were seeing something, and this cycle, this stream was telling you, what is this? The yellow Volkswagen. And the other part is the where stream. The where stream tells you how to interact with what you're seeing. This means, is the car coming towards me? Do I have to jump to the side of the street so I don't get run over? How far is the car from me? How quickly is it coming to me? So this gets you the information about where. So this means the Mishkin and Unterglider theory, the dual stream theory, was saying to us that the vision was going into two different streams. Over the years, we learned that the same is true for language. Hickok and Popple in 2007 said that there's a dual stream also for language. How is this so? They said that there's a ventral stream. The ventral stream is located on both hemispheres. It's mostly located in the temporal lobe, and it's concerned about understanding what is spoken to you, or what you're seeing in your vision, or what you're hearing in your ear, what is spoken to you. So with all of these informations, you can get a ventral stream. And this ventral stream helps you for your inner thinking, what you're thinking without speaking to other people. This is located mainly in the temporal lobe, and basically uses the inferior frontal or fronto-occipital fasciculus, the inferior longitudinal fasciculus, and the uncinate fasciculus to bring the information from the parietal lobe, from the occipital lobe, and from the lower temporal lobes through the temporal lobe to the Broca's area on the left side of your brain. But there's a second stream, second connection, second street that goes through the brain. And this is called the dorsal stream. And this dorsal stream brings the information about how to speak, how to repeat this. So with this theory, the Broca's area, the Wernicke's area, or the terms that we know as Wernicke's aphasia or Broca's aphasia, these became history. Today, we know how the cortex is working and which parts of the cortex are taking part in this function, and what white matter connections are taking part in this function. Therefore, whenever we see a lesion or a tumor inside the brain as neurosurgeons, now we know how the speech, how the language might be affected by this, because we know what the cortical areas are and what their connections are, and how our tumor relates to those areas. And we know these connections by studying neuroanatomy. Over the years, people started getting this information also in live people, without having to do a dissection, without having to do an anatomical dissection. They came out with functional MRI. And then somebody realized that the functional areas in the brain get co-activated. If you activate the motor cortex on the left side, the motor cortex on the right side is also activated together with it. And this co-activation of different portions of the brain at the same time brought us to the point for us to develop a machine called the technique called the resting state MRI. This resting state MRI gets a functional MRI of the brain for hours and hours, for long hours, maybe for 6 hours or 9 hours, for a long period of time, then makes associations between two parts of the brain and gives us information what functions might be working together. With the help of these, we understood that there are functional networks in the brain. One of them was the connection I was telling you about, the speech, somotomotor, the speech network. Then you have a visual network that is concerned about the vision. Then the somotomotor network, which is concerned about our motions. Then attention network, a default mode network that is active while you're not doing anything. So this means we came from a very primitive understanding of the neocortex, where we thought that there was only one area for speech or one area for motor function, to a point where we know that each function, like language, like speaking, like attending to something, or doing something, or controlling something, these are all distributed inside the brain. They are not localized to the brain. So we switched from a localization type of understanding of the cortex into a large scale network. Finally, another very important neurosurgeon, Hugues Dufaux, you're seeing the picture here, taught us that different portions of these large area networks are also speaking to each other. So they are coordinated with each other. Like the visual functions that are coordinated with each other, these different functions like speech, language, attention, all of these are also interacting with each other. So he came with this theory that he calls the meta-network theory. Let me explain you this in a little more detail. I'm sure you're going to understand it very clearly. We have inputs that Marcel Messelam told us, like the visual input, seeing something, the somatosensory input, touching something, the auditory network, hearing something and understanding what's going on. And then the limbic system gives us information about if we're thirsty, if we need salt, if we're hungry. All these informations are coming. This information is fed into the networks that I just told you. These are working memory network, language network, semantic network. Semantic means what is this called? Like this is a pair of glasses, the pair of goggles, and the name for it means it's semantic. Then our emotions, social cognition, social understanding of each other, and then attention network. All of these single networks are spread around throughout the brain. And then these networks that you're seeing here, the spatial cognition, working memory, language, semantics, are talk to each other, interact with each other, and they interact with each other context sensitive. So when you're speaking and trying to retrieve words while you're speaking, you need to interaction of this language network with the semantic network. And if the language is telling you a love poem, then you get emotions. And then the emotions need to be interconnected with the language and the semantic network. And then you have to remember those. So they need to go into the working memory. So these get integrated. And after the integration, after these came out, we try to interact with the surrounding using, again, like these distributed networks that are distributed around the brain. And we create the outputs like motor functions or speech or painting something or writing a poem. things like these. So if you ask me what is the brain is an association machine. By creating associations, it creates coordinated responses. We think what we have to do from inner and outer stimuli. Thank you very much for listening to me.
Thank you very much, Professor, for this fantastic presentation and this very informative lecture. And we have learned a lot through this presentation. Thank you very much.
Thank you very much for your kindness.
Professor Salman.
Thank you very much for taking your time and listening to me. I'm very honored to be with you tonight. Thank you for being with me.
Thank you very much.
The honor is ours.
Thank you very much, Dr. Koray, for the great presentation. It's enormous amount of information for the short period of time. I just want to give a comment. We are so easily prescribing, functional MRI, different types of MRI or different types of investigation for our patients. But in times, we have to come back to the history, to evolution, to understand how much time it took for a lot of people before us to come back for this easy prescribed, like moments like we are doing now. And thank you very much. I learned a lot personally. Thank you.
Koray, I think wonderful. I really enjoyed that. History is amazing, and to see it so fluently coming from you was excellent. Thank you for your talk.
Thank you, Professor Sharif. Thank you. I'm honored for your presence. Thank you very much.
Thank you.